Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everybody. So many of us deal with back pain. Some of it's chronic, some of it pops up from time to time. Many of us pop meds. Sometimes you go to a physical therapy treatment, maybe the chiropractor. If you're finding that it's really not making as much of a difference as you thought, how about a different modality? One that's called Rolfing, Rolfing, Rolfing. I didn't know it existed until I met her. She's a certified Rolfer, and we're going to learn more about that today. Karis joins us on the program. How are you?
I'm doing great. How are you?
Very well. Good to have you here. And why don't we reset for everybody what exactly this Rolfing thing is?
Most definitely. So Rolfing is a type of bodywork. It is a modality, as you said. It focuses on the fascia in our body. It is a type of connective tissue that is everywhere, head to toe, superficial to deep. It is what provides support to our body, but allows movement to occur. So over time, our fascia becomes dehydrated. It can become adhered from compensations from injuries or even tertiary compensations. So I go in and release those areas, make that fascia hydrated and adaptable so that the body can function appropriately where it's supposed to be in space. And along with that, we get pain relief.
So I kind of detect that you said it can get dry. So does the fascia dry out sometimes?
Yeah, just if just like everything else in your body, we are or majority of us is water. So it can get dry. It can get adhered and sticky. And just going through and giving it some input can help loosen it up, hydrate it so that it can move and be more adaptable.
So now that we're doing a little bit of video here, I would love to get a feeling for what you're doing with your hands when you're working on somebody. Because originally, I look at it sort of like massage. So can you like kind of show us what you do?
Yeah, so I'll try to do it on myself. So I use like a slow, deep pressure. This is one tool I use, just my fingertips, and it is very slow. And I just kind of move along this way, very slow, and just kind of, I feel for the fascia, and I try not to slide over it, and I try not to push too far into it so it doesn't resist me. So I'm getting a nice glide going right here on my arm. It's kind of awkward. I don't really have it supported, but yeah. Other times I'll use my fists, my knuckles here. Let's see. So just kind of an awkward position for me, but just kind of, again, getting a little bit deeper. And then I also use my elbow, which is kind of hard to do on myself, but go along like this, which is really great. So I'll do the glides, but there's times that I have to do kind of a press and hold in the fascia. Like if it's not gliding for me, I'll just give input and hold. And that's really cool because like I can feel myself like kind of like quicksand sinking in as I just kind of hold there for a while. I might call for some movement or do some movement while I'm doing it. And yeah, all of a sudden, eventually you feel yourself just sink in.
So while you were doing that, I was feeling it on my arm, trying to get an idea of what it feels like. What I get from that, trying not to push too hard, but to feel something underneath the skin, it almost feels like it's I don't want to say bumpy, but it's not like a perfect smooth ride. I don't know if that makes sense.
Yeah, and it's like that. Some people, it does feel more like that. Other people, it is a smooth glide. So when I do feel a little bit more of that bumpiness, I just kind of hold myself back and I stay there. I don't rush past through it. I want to break that up.
Okay. So then when you're feeling some kind of tension or kind of pushback, call it bumpy, whatever, that indicates potentially, maybe a problem with the fascia.
Yeah, that indicates that area probably just needs me to be a little bit more patient with it. It's maybe it's not ready to go completely deep yet. So I just kind of hang there and wait for it to move for me.
So I'm thinking
I've
that
had clients tell me that I was going to say, I have had clients tell me that I have to be a very patient person to do what I do.
that's where I was going. It almost
Yeah.
seems like you really need to know what you're feeling, based on experience, and then
Mhm.
where to put it. How do you know where to push? I don't know if the best word is push the fascia, but where to move it to. How do you know?
So you can go different directions and stuff. So I'll start one way. If I don't feel like I'm getting really into it, I'll go a different direction. And so it's just basically going in there and like loosening it up rather than moving and pushing it somewhere.
Now let's apply to the back. So many people have major back issues that pop up from time to time, or they're just, pre-existing with chronic. How does this support that?
Oh, so I've had a lot of people come to me for either chronic pain that they've tried everything for. I'm personally one of those people that have experienced that, and Rolfing has changed my life in that way. And then I've also had people come to me with like, acute flare-ups. So a lot of times when people come to me, tell me their lower back hurts, I will assess their pelvis. Is it tilted anteriorly? Meaning like the psoas, the front hip flexors are tight, and the adductor muscles, the inside of the legs are tight, and they're pulling that pelvis, tilting it forward. Other times I look and people have a posterior tilt. So like the hamstrings are really tight, pulling that pelvis back. So I assess that first, determine if there's a tilt. And a lot of times with people with lower back pain, they have an anterior tilt because that's creating more of a curve in their lower back and creating shortness there. So let's say the person has an anterior tilt. Well, then I go on to look, okay, how are their adductors presenting? So the adductors are the muscle group in the inside of the leg. And a lot of times they start to come forward towards the quads because they need to assist the psoas muscle in the quads in flexing the hips, because a lot of times the psoas is really busy trying to keep the spine stabilized. So I take a look at that, and usually I'll see both, or one of the legs has it more presenting more anterior. I will also take a look at their knee hinge. Are their knees tracking directly over their feet? Or are they kind of deviating out to the side or deviating inwards? And along with that, I take a look at the ankle hinge. Is the ankle hinge straight, or is the ankle hinging on a diagonal or opposite direction? So it is important to have these all horizontalized from like the waist down, because if there's diagonals and shifts, gravity is going to have more of an impact on those joints. And if we feel like if we get those, aligned horizontally how we want them to, they can provide better support for the back. Allowing the back muscles, the paraspinal muscles, tiny little muscles that are there just to hold your spine up, allowing them to like actually relax a little bit and not have to hold on so tight and have your back kind of raging in pain because it's holding on so tight to keep your spine straight. So a lot of times, I'll tell people, I'm going to work on your feet. I'll be working on your legs and your back when I do lower back pain.
Wow. I did not realize that there was so much physiology, anatomy that's connected to this that you need to know in order to do Rolfing. Did you have an interest in that before you got into this?
Yeah. So my background, I was an occupational therapy assistant. So like I've been through anatomy multiple times. I've been through kinesiology a couple of times. Yeah. So luckily I did have that understanding of it. It's still something that I'm continuing to learn. It's continuing to grow, but yeah, I love it.
Wow.
I can't imagine not having an idea of what's going on in your body.
And I agree with you. The more I learn, the more I'm fascinated, the more I realize that our bodies are amazing machines.
Oh my goodness, yes. And it's like the relationship of the nervous system with like the tissue, the musculoskeletal system, it's just phenomenal.
And how it has the amazing ability to heal itself, but sometimes things get in the way. This is my belief. If we lived in a perfect world with no stress, no call them pollutants in our food, pesticides and everything, all of that stuff, we probably wouldn't even need doctors. or very rarely would need to go see one because our bodies would heal themselves. As you go back to the 1500s, 1600s, the doctor wasn't as readily available and didn't have
Mhm.
as much technology as today. It's almost
Mhm.
as if our doctors had to keep up with all the challenges in life that cause us to get sick. It's more of
Mhm.
the environmental stuff. If you have your body's in perfect balance, you're probably going to be fine, but that's not realistic in today's world.
And that's the thing is like, because of all that in our jobs and injuries we've had, just our health in general, our lifestyle, like that's what makes us all different. That's what makes all of our fascial adhesions that we may have different. And that's why everybody I work on, it's a completely different case every time.
Can
Even though
you
I might do like the same structured, like, but, I'm also thinking like, okay, what muscles do this movement that this is getting stuck in? So then I go and work over the fascia of those and then take a look again, reassess, and like, oh, okay, yeah, that was the area.
and that's the key point that you address what's connected to it. When we first started talking, I was thinking, all right, well, she just works on the fascia. Oh no, it goes way deeper than that. It's what the fascia is connected to that you need to get to root cause.
Hmm.
That somebody's got a back problem, but no, it might be their
Yeah.
pelvis, it might be their knees, it could be many different
Hmm.
things that cause that back pain.
Yeah, they may have like sprained their ankle when they were younger and just that a little bit, the fascia changed and it compensated for that. And then it kind of stayed like that. Even though they
Wow,
don't have the injury anymore, but that compensation can still stay. So yeah, that's kind of what we're addressing.
eye opener. Got to tell you,
Cool.
right here. Um, can you give an example of somebody with back pain that you helped?
Yeah, I had this one woman, she's has gotten massages before and, get off the table, not much relief, goes on with her day. She came to me, lower back pain. She's had it for years. And I actually didn't even touch her lower back. I did a lot of work on her from the hips down, a lot of work on her ankles and feet. And when she got off the table and walked, she was very impressed right away. But then she bent over to put her shoes on. And she almost started crying because it'd been years since she had been able to put her shoes on without any lower back pain. And that was so exciting and cool to see her experience that just and it stayed for her.
Wow.
Hmm.
And I'll bet you right now, so many people hearing, watching are thinking of things that their mobility challenges and
Hmm.
that it could be something connected to their childhood.
Hmm.
Wow.
Yeah, definitely. And then, yeah, just like the other day, I had a client, I was working on her neck, and she's like, I'm feeling that in my lower back. Does that make sense? Like, is it connected? And I'm like, yes, totally. We have fascial lines in our body. I have this amazing book on myofascia, and it talks about the fascial lines, but like you have connection of fascia from the top of your head all the way, down the back of your neck, all the way down your back, down your legs, into the bottom of your foot. So that's the beauty of the 10 series is because sometimes somebody might be experiencing pain in their neck, but it's really coming from their foot.
So it's interesting that you're saying that because, somebody might feel something or touch something and then feel it low and then say, oh, it must be a nerve. I hit a nerve ending or something. Maybe
Mhm.
not. Maybe not.
It could be coming from somewhere else. It could be. It could be from somewhere else. You can work on that all day, and if you're not getting any relief, then yeah. It was actually fun. One time, one of the last few times I saw my Rolfer, I was telling her, yeah, my right forearm's really killing me. So she did some work there, felt good, but she went over and did my left arm, and oh my goodness, my left arm was way more intense. And I was like, what is that relationship? She goes, your spine. Everything's connected to your spine. So if there's something tight over here, pulling on the spine, it's going to pull everything else on the opposite side of the spine, if that makes sense.
Oh, it does.
Hmm.
in,
Yeah.
in a scary way, because when you think about all these pains that we feel, they might not be what we think they are.
Hmm. Yeah. And they can be. They totally can be.
Of
But then,
course.
yeah, so, but yeah, this the people that come to me that have been like, I've tried everything for this, I've, massage, chiropractic, physical therapy, acupuncture, all this stuff, which a lot of that stuff can be good too. I think a lot of that stuff is good in combination with Rolfing also. But yeah, and at that point, it's like, yeah, it's got to be somewhere else in your body that's coming from, because you've had multiple people working specifically on that spot and it's just not going away. So let's take a look at everything else. Take a look at the big picture.
I'm getting the big picture today. I got to tell you, we've talked before, Hannah, and you're great at explaining everything. Today's the first time that I really see the benefits of Rolfing and how critical fascia is in our bodies.
I'm really hoping that you'll go find yourself a Rolfer soon and experience it for yourself.
It's on my mind more than ever.
Yeah, it's such
Based
a
on
cool
that.
experience. You'll love it.
And okay, so let's say you go for a session. Do you need to identify some issues that you're having, or does the Rolfer kind of do a full body scan, if you will, and kind of identify?
So what my Rolfer has done for me and what I have done, and kind of like what we learned in school, is we talked to our clients before, just get a little input on them. Like, what do they do every day? What are their goals from Rolfing? What kind of ailments are they feeling? And then from there, I will do like my own assessment, take a look at them in standing, take a look at them in walking, also do some assessments on the table. And from there, based on what they've told me and what I've observed and felt, I'll create a session.
Okay. So then you kind of hyper focus on certain areas based on the information you have.
Yeah. And then I tell them, okay, again, like for instance, lower back pain. I tell them like, hey, but I'm seeing this going on in your legs and that's not providing support for your back. And I think we could get your back to chill out a little bit if we create more support in your legs. So like, that's why I'm working down here. So I always explain to my patients why I'm not I do work in the areas where the pain is, but I also explain to them why I'm working in other areas and why I think it's related.
As people get older, flexibility is so much more important. And I picked up on that like a year ago, where just stretching can make such a difference. And when you're younger, it's like, I'm not going to stretch, even go for a jog. I'm just going to hit the pavement, not even give it a thought. In terms of stretching, let's say somebody's got, and maybe it hurts. Maybe it's a challenge. Could fascia issues come into play with just stretching?
Oh yeah. Yeah, actually, yoga is probably like one of the best things you can do. Yoga and walking are like the best things you can do along with Rolfing, because you're continuing to stretch and get the fascia to adapt and to loosen up, to allow freedom and adaptability to occur.
This is pretty cool.
It's so much fun. I love what I do. I love that, the experience that I personally have with it, and I love sharing it with others.
Now it has crystallized why you have such a passion for this. Now I get it. Now I truly get it, how important it is. How about another success story? We talked about that woman in her back. And any other ones stand out for you?
Let's see here. I can't think of any. Okay. All right. So I have clients that feel sciatica pain.
Oh my gosh. You just reminded me, got to jump in if I may. Don't mean to cut you off.
Huh?
I've never had an issue with that until like the last 6 months. And it's only when I'm sitting in a certain seat position, never have any issues.
Are you sitting on your sit bones, or are you back on your butt? Like, because right now I just tilted back on my just kind of more back on my glutes. But if you tilt forward on where you feel yourself sitting on the pelvis, because what happens is when you sit back and just kind of relax, the hips rotate outward, and the muscles that rotate the hip outward, the top one is the piriformis. And I don't know if you've heard of piriformis syndrome before. It mimics sciatica. So a lot of times, we have to determine, is this true sciatica? Is it coming from a nerve impingement in the spine? Or is it the piriformis muscle that the sciatica nerve dives deep under? Is that really, really tight and pushing on it? So that's where I will, kind of work on the person's back and work on those external rotators to see if that gives them some relief. Also, I have found that usually the side that they have it on, the front of the opposite pelvis is inflared. So there's a rotation occurring in the pelvis. So it's tight back here and it's tight right here. So we work on loosening those back up to get the pelvis to where it's supposed to be.
Wow. So you may think that it is sciatica. It might not even be.
Yep. Wow. And if I have someone that is not getting relief, I tell them, hey, go see a doctor, get some imaging done, because sometimes it's not just that, and you need to do a little bit more. So, but yeah, I've had people that I've been able to get that rid of that for them, and it's been very cool and very exciting.
The supposed sciatica in my situation presents itself maybe once a month, and it maybe twice, but it really depends on where I'm sitting. So, if I'm on a plane, maybe it'll flare up. And then, you can't really go anywhere. Or it could be in somebody's car where the position of the seat is a certain way. So now you make me wonder, maybe it's not. Maybe it's,
the best thing I think you could do after that, when you notice that, is walk,
Yes.
Get a nice walk in, and that usually will loosen it up.
I was on a train at Amtrak last month visiting my son at college, and it was super packed. So the position, there was people next to you. It's like, there's only so much you can do. So it's like, all right, well, I got another hour. And what I did was I got up and just walked like I had to go to the bathroom, and then came back. And you're 100% right. As soon as you get upright, everything's great.
And that's great. It shows that your body's already healthy and willing to respond to that. I know before I had Rolfing, if somebody were to tell me just to get up and walk and help my lower back pain, I would just be like, it's not going to make a difference. Now it does, because my fascia, it doesn't fight me when I try to get rid of it. It's just oh, okay, guess I will adapt.
Wow.
And flow. Yeah.
You've explained your challenges before. Got about a minute, but I want to illustrate how it changed your life once again for everybody. What were you dealing with?
My right femur is longer than my left. So I have a leg length discrepancy, which will throw my pelvis off. And I've had upslips where one hip's way up high and this one's still down here. Very painful. And also it affects the SI joint, the relationship there. So with Rolfing, I used to wear a shoe lift to help with this pain. But once I got my 10 series, I no longer have to wear a shoe lift. I haven't worn one since. And I may occasionally feel my lower back pain, but it's nowhere near as intense. It goes away much quicker, and it happens way less frequently.
Wow.
Yeah, it hasn't been debilitating at all in the past 5 years.
Perfect testimony. And that's what led you into doing this work.
Kind of. I learned about the work and I was like, that makes sense. I want to do it. And I never even had the work done before. Once I experienced the work, I was like, yeah, this is worth uprooting my life for 9 months to go live in Boulder to learn this technique.
Yeah. And that's, we talked about that before. You went to a state for almost a year, moved just to learn this. Amazing. And now I get it. I got it before. Now I truly get it. Crystal clear how beneficial this is. Hannah, how do we find you if somebody has a question? And also, obviously, where you are, you're Michigan?
Yes.
Okay. That's where you can treat somebody. Unfortunately, can't be done virtually. So how can somebody find a Rolfer in their area? So your web address, and then
so if you want to talk to me, ask questions, or even schedule an appointment with me, you can go to my website. It is revelationrolfing.com. And if you want to find a Rolfer near you and experiencing Rolfing for yourself, you can go to rolf.org. It is the Dr. Ida Rolf Institute's website. They have all the Rolfers that are registered with them listed on there in every, which state or country.
Amazing talking with you today. Thanks for making everything even clearer. And truly appreciate it. Thanks again.
Of course.
We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.